Thanks for staying with us right here on Sunrise this Hope Day Wednesday on our health slot. Now, of course, we look at fetal alcohol syndrome, which is a characteristic pattern of physical and mental birth deficiencies caused by alcohol consumption by the pregnant mother. Now, Dr. Marlon McKay joins us this morning for a conversation, and we're taking your calls as per usual on 0114471742 or 0114471620. And that's what we're talking about this morning. Doc, thanks for joining us this morning.
Thanks, Penny.
All right, so I was just asking you just now off air, like how prevalent is it, this fetal alcohol syndrome in South Africa?
Yeah, so unfortunately South Africa is one of those things that, again, we kind of hold a world record for it, amongst others. So we know that the prevalence is much higher in certain places in South Africa, and in particular the Western Cape. And in certain areas, it's the average prevalence about 6.4%. So that equates to about 64 babies or kids per 1,000 births of fetal alcohol syndrome. So that's quite high compared to the rest of the world, where it's a lot lower.
Well, I guess it relates to like the levels of alcohol consumption in our country in recent times, how we probably like in the top 3 of that. And we're also seeing a spike in women also drinking. There's clearly a relation? Yes,
absolutely. And the problem is we now realize that any amount of alcohol is dangerous during pregnancy. And in particular, I mean, most women will say that, you know, by the time that they find out that they are pregnant, they didn't even know, and so they were taking certain stuff. And so we even know that there's a lot of harm done by the alcohol even before they find out that they are pregnant. And, you know, the fetus is so immature. The way the mother drinks the alcohol, it passes through the placenta, the umbilical cord, to the fetus. And with the fetus being so underdeveloped, cannot handle and process and metabolize that amount of alcohol and break it down. And so damage is done to organs, and especially to the brain, at that very early age.
At the very early stage. Okay, so another conversation is, besides people not knowing that they're pregnant, is those who say that, yeah, but I was drinking, you know, before, you know, I'm fine. Now that I find out, I'm sure I can do 1 or 2 glasses every now and again.
Yeah, so it's very difficult to have done studies that will show exactly how much or how little alcohol will cause harm. And I think most societies and most doctors will agree now, and especially gynaes will agree, that absolutely the only safe amount of alcohol in pregnancy is no alcohol.
Is no alcohol.
And so I think that should be the overriding principle, that no mother who is trying to fall pregnant or who is currently pregnant should ever have any alcohol intake whatsoever.
Okay, so let's talk about the impact of consuming that alcohol to this baby after they're born.
Okay, so so what we see is a number of things, mainly three things: physical abnormalities, brain abnormalities, and then learning or developmental abnormalities. And the physical ones, they generally have a small face, they have small eyes, narrowed eyes, they have a thin upper lip, and, you know, most of us have a little ridge just below the nose, in between the lips, that space there. They have smoothness there. So there is a certain physical look that some of the babies have. All right, bearing in mind that fetal alcohol syndrome is kind of at the worst end of the spectrum. There are a number of milder forms. Then in terms of brain neurological, there's definitely some element of mental retardation, which will develop into poor development, learning disabilities, and then spill over into behavioral abnormalities. These kids are impulsive, they're jumpy, they're ADHD, they're slower at school. Some have a normal to average IQ. So it impacts the way they look, the way they behave, and the way their brains develop.
Okay, so now, obviously, these are things that can sort of like be seen later on in life. But at that time, we're thinking, okay, it's still a fetus. I mean, it's just a glass or 2. It's nothing major. Has there been any studies like in recent times to sort of like support all of this development that you're talking about?
So our biggest problem is there's no diagnostic test. So when the baby is born and there's a history of alcohol intake, or there's a certain degree of suspicion, there's no one diagnostic test, like a blood test that one can do and say, okay, this child has. Sometimes there is the physical look, as I said, that syndromic look, so you can look and see the specific abnormalities on the face. But sometimes it's a diagnosis that has to be made a little later, once mom starts complaining, my child is not behaving, there's developmental delay, they're not walking when they should, I'm not happy with the way he looks or his eyes look, and then in retrospect that diagnosis is made.
Okay, so now another question is that what are the chances that the child might become sort of like an alcoholic a bit later on in life?
So we don't really know in terms of studies. Whether that, just because the child is a fetal alcohol syndrome baby, whether that will translate in an increased risk. So there's no real studies, and of course the risk of becoming an alcoholic or dependent on alcohol at a later stage depends on numerous other factors and not just related to alcohol exposure during pregnancy.
All right, now the child is born. What about breastfeeding, drinking as well while they're breastfeeding? Does that still continue?
So again, it's something that can pass through and can go into the breast milk. So even although the damage is done in utero, so in other words, all the damage to the brain and to that baby happens during the pregnancy. The damage stops after that. So any other drinking will not have an effect on the outlook of the baby. However, there are still harmful effects of mom drinking and breastfeeding. So it may not have neurological issues, but we still advise no alcohol intake.
Okay, now what happens now with the mother who's thinking, you know what, actually I had been drinking, I don't know if my child could have been exposed to FAS, and what can they do?
Okay. So the first advice is stop drinking immediately. The moment you find out that you're pregnant, or the moment maybe you're watching and you realize I can harm my baby, stop drinking straight away. Prevention is always better than cure. Even if you go to your gynae and you tell the gynae that, look, I have been drinking, it's very difficult to do anything about it, and it's very difficult to ascertain whether you will have, because we don't know how much alcohol is enough to cause that particular type of damage. And so it's a wait and see approach, and I think we just pray that the baby will turn out normal. But bottom line, stop drinking straight away. Let's
take a caller. We've got Miriam from Johannesburg. Miriam, good morning. Thanks for holding your comment or question this morning. Hi, Miriam.
How are you?
I'm good, thanks, and you? Okay, we've lost Miriam. Okay. This is a strange question. How come if the father was drinking and the child, you know, it doesn't affect the child?
Okay, so the father's job is really just to fertilize the egg, and that's where it stops. The development happens in utero, in the mother's womb. The father is now out of the picture. The egg is fertilized. It is now implanted into the uterus. So everything is dependent now on mom's health. And the healthier the mom is, the better the development of the baby. And so it's got now nothing to do with the father. And same with HIV. So once this fetus is now implanted, mom, it's all up to the mom to look after that fetus and to make sure it comes out okay.